So it's a fully private system in the United States. And what that means is that, most of us make jokes here in the US about like not calling me an ambulance. It's like such a thing, especially amongst young people, where it's like, come on, like it doesn't matter if you have a broken leg, like don't call an ambulance for me. Welcome to Overlap, brought to you by Breakthrough News in collaboration with Wave Media, our friends at a private media house in China. My name is Rachel Hu, and I'm happy to host today. Overlap is a global conversation show with rotating hosts that is based on a simple concept. While the US elites are working to build a new Cold War environment, with China, we want to do the opposite, with people-to-people conversation, dialogue, discussion, and virtual exchanges to show how much we have in common and how much we have to lose from a new policy of isolation and demonization. I'm excited to be joined today by two excellent guests. Today, I'm joined by Dr. Samira Adri, a graduate of the Latin American School of Medicine in Cuba, also known as ILAM. She's a Cuban-trained doctor who currently resides in the United States. I'm also joined by Dr. Steve Ia, who's an orthopedic doctor working for the public hospital, Rujin Hospital, in Shanghai for more than 15 years. Welcome to the show, Dr. Steve and Dr. Samira.
Thank you.
So happy to have you join. So I really want to start today, I think, with going through, for an American audience especially, who is not super familiar with the Chinese healthcare system. How does the Chinese healthcare system work, Dr. Steve? Is it a private healthcare system? Is it government funded? And is it government run? And what exactly does that mean, especially as somebody who works in a public hospital?
Yeah, interesting question. Public hospital is the main medical service provider in Chinese medical system. I don't know the real number, but I believe the public hospital system owns the 70% beds in China and owns most of the best doctor. I think it's different from Americans. Another thing is the price of medical service in public hospital is limited and mainly decided by government. Most of the population in China are covered by Yibao, which is the name of government running health insurance. And we do have a lot of private hospital invested by private enterprise, but compared with public hospital, it's like just like an ant and elephant.
Definitely, really interesting. I think for an American audience, I'm curious, Samira, kind of your reaction to some of this information, just because we're really kept in the dark in the US about what China's healthcare system is like. I mean, the most exposure we kind of had was during COVID-19, where for the most part, the US just called it authoritarian. So it's interesting to learn about the public hospital system in China and kind of the Yibao system. But I'd also like to follow up too, before we get to that, Dr. Steve, what exactly is this Yibao system? How are people paying for healthcare? Is the government paying for healthcare? Are individuals paying for healthcare? What does it look like in that regard?
Yeah, the medical expenditure is a big question, and we cannot answer it easily. But I'll try my best. In Chinese medical system, the consulting fee, nursing fee, operation procedure fee, like what I said, are decided by the bureau. But as for drugs or medical devices, the price is complicated. There is a time once the drugs and devices are expensive. A big reform happened in 2019, which is called National Centralized Drugs Procurement, NCDP. The NCDP is like a direct procurement. The administration organized all the public hospitals together, which means they collected the volume of medication in public hospital, which is huge amount. Then the pharmacy company need to bid for the volume. This procedure means the middleman or reseller is kicked out, sort of. They cannot make huge profits easily like before. As far as I can remember, 10 years ago, the outpatient registration cost is 14 RMB. Now it's 25 RMB. And it's 80% covered by Yibao insurance. As we all know, China is a large country. We have well-developed area and less developed areas. It's the same all over the world. I'm not a policymaker or a hospital director. I just have an interesting example to give. It's my father-in-law. He got hospitalized about 3 weeks ago because of a stroke. He smokes and drinks too much, and unlucky he got a stroke. After 12 days treatment, he's been much better and discharged. When the day he's back home, I saw his bill of hospitalization. The total expense was about 25,000 RMB. It's about less than 4,000 US dollars. But the point is, guess how much he paid out of pocket?
How much?
Only 800 RMB. It's like $130.
Oh, wow.
Yeah. So what I want to say is, in China, the healthcare system has been improving these years. I'm not saying it's a perfect system already, and there's always somebody complaining about that, but at least it's getting more and more affordable for the medical service. Yeah.
Certainly. I mean, I think one of the things that's most interesting to me about the Chinese healthcare system is that public hospitals are held in such high regard. So I'm curious, Dr. Samira, just as somebody from the United States, what your thoughts are on this. Of course, as somebody from the US, I have a lot of my own reactions, but as a doctor, I'm curious to hear yours.
No, I think it's quite amazing to hear the Chinese example of, number one, a government-run and public system dominating, as opposed to what we have here in the States, which unfortunately 60% is covered by private coverage, and then 30%, about 30% being public funded hospitals and clinics. So that's a huge difference in terms of where we're going and who's determining how healthcare is delivered stateside. And also the cost. Amazing that, a man could suffer a stroke and be hospitalized for 12 days and only have to pay about $100 out of pocket. 12 days in a US hospital, private or public, would not amount to that kind of money. It would be thousands and thousands of dollars. And, I can use also a very close example, my own father, who also unfortunately suffered a stroke. And he was hospitalized for 2 days, and the bill was about $12,000.
Too much expensive for me.
Luckily, he's over 65 and is covered by the government-funded Medicare insurance for elderly people. But that led to be a substantial amount of it being covered, his hospital stay. However, it did not come without a fight. We had to be on the phone with the insurance company for the hospital, which was a private hospital, debating whether or not we owed them that money. And so it's a very complicated system for us stateside, and it takes a lot of know-how to maneuver the system. If you don't have an advocate in your family or, in your community, then it can be very daunting for just an everyday person to handle medical issues, especially this billing factor.
No, certainly. I mean, one of the things I think that's really interesting in thinking about the Chinese system and the US system is just that the fundamental reality in the United States is that it's that we have extreme wait times. I mean, it's not that private healthcare is superior because you have less wait time. The average person in the US who really is an everyday person is not going to be able to get the kind of healthcare that expedites your ability to see a doctor quickly. I mean, you end up in the hospital in the US. Personally, I've never waited less than probably 6 hours to see a doctor. I mean, 6 to 10 hours is pretty standard in New York, where I'm from. So I think that that's what's kind of wild about it. And on top of that, you end up paying thousands and thousands of dollars in addition to the fact that you're also waiting an extreme amount of time. And that's just to see a hospital. The average wait in the US is actually 26 days to see a primary care physician. So to even see your doctor is on average a month wait. So it's really not necessarily a system that's better, and you pay for it on so many levels. I mean, there's so many examples I can think of this. And I'm really interested on the Chinese side of things, how the system works, because in the US, whenever we think about something that's government funded, it's kind of immediately like associated with something that's bad or something that's not quality, because in the US, we do have public hospitals, but those public hospitals, they really are not well funded, and they're starved, frankly, by the government in some ways on purpose, because they're the only hospitals that serve poor and working people in any way, shape, or form. So I'd love to hear more about in China how this works. What's the perception of public hospitals? If you could speak more about kind of the way people think about care and quality of care in China, Dr. Steve.
There's always a divided opinion about this. The government is trying to make the medical service affordable and available. But it's impossible sometimes to make it happen at the same time. According to my opinion, these years, the medical expenditure, especially the medical cost, is much, much better. So probably these years, people or patients are getting more and more satisfied with medical service because it's just, okay, acceptable. And for example, the outpatient department, this morning I saw like 30 patients in the morning. Each patient I gave him like 10 minutes or like 12 minutes, and but it's cheap, or it's the price is acceptable. So people may be not that satisfied with that, and people always want to see a doctor for more than like 30 minutes or 45 minutes, but it's impossible in China or in Shanghai. So we provide a medical service at an acceptable price. So patients maybe they have to take that. But I think the first step is make it affordable.
Yeah, no, I mean, it's really interesting that, to me, that in China, people have a really positive view of public hospitals. My kind of question, Dr. Samira, for you and bringing this conversation in is that, one of the things that strikes me about the Chinese healthcare system, and I'd like to hear from you too later, Dr. Steve, about the concept of debt. But it really is interesting to me because in the US, we have no price caps. I mean, it's entirely a private system, which means that private interests, private corporations set the cost of everything. And so the average person in the US is really suffering and struggling with the concept of medical debt, which I don't really think is the same. The issue doesn't quite exist in China, and it doesn't quite exist in Cuba. So, Dr. Samira, I'd love to hear your thoughts on American medical debt and the concept of being bankrupt from going to the doctor in the US, and your experiences in Cuba and how that's different.
Right. Truly, it's unfortunate part of our reality in the United States that medical care has to incur so much debt on the individual and his or her family, and basically bankrupt a lot of families, lead them into destitution, all in the search of better health, right? It's a tragedy. It is what it is what it is. It's a real tragedy that in the United States, people have to go into debt because they want to be healthy. But again, it speaks to what you were saying, in that there is just a disproportionate representation of the say that corporate powers have in determining health services and healthcare delivery in the United States. And more, unfortunately, states don't want to expand services that would broaden the scope of coverage of healthcare for their populations, because there's this attitude that we don't want government meddling in our health. We don't want government meddling in any part of our lives, but it really has serious repercussions. It starts with one person, and it just has a domino effect on the rest of the population. And that's what we don't really realize or understand in the United States. There's a level of health illiteracy that we really have to tackle. And the corporate powers play on the fact that people don't know how this is supposed to work. There have been numerous polls done in this country about what people prefer in terms of their health. And unanimously, people would prefer health to be a human right, that they wouldn't have to shell thousands of dollars out of their pockets to take care of their health. However, that's not being played out in terms of policymaking and decision in the laws that govern how health is delivered in the United States, as opposed to Cuba, where it is decidedly made clear that health is a human right and that the state is funding this healthcare delivery all out, right? So you have a situation where, for example, the biotech industry that is heavily involved in development and research of drugs and treatments for different things is subsidized by the government. And so there's no competition there. There's no need to lie about, the results of clinical trials or the efficacy of drugs, because these treatments are being developed to solve the everyday problems that arise from the health issues of the Cuban people. As opposed to the US, we have random pharmaceutical R&D or research and development companies doing what they want to, and also going towards what will make profit, as opposed to trying to solve the real problems of health issues of the everyday US person. So that's the difference. It's a difference in priorities that is very stark to see, and how that creates a situation where people are in debt is unimaginable. In Cuba, there is no such thing as somebody being in debt for their medical health services. That is unheard of. You show up to the doctor's office, whether it's on a local level, a municipal, or a national level, you get taken care of. You're not turned away for any reason. And whatever it takes to ensure that you have the necessary diagnostic tests run or the necessary care is provided for, as long as it's within the scope of reach of the services provided at that institution, they do it. And it may take, a little bit longer. You may have to be hospitalized for a few more days than maybe if you had access to high tech everywhere, like we do in the United States. We don't have access to it. It is there. Most of us don't have access to all this high tech because of the prohibitive costs, but it's there, right? As opposed to Cuba, you have limited resources, but it's used conscientiously, not to be wasteful, not to make profit. They're not going to just send you to the MRI because they want to make a quick buck off of your hospital visit, right? And then send you a bill. That's not what this is. So if it's not indicated for you, you're not going to get that MRI. So there are layers to how this rolls out, because number one, the intention from the beginning is very distinct, right? We're in a profit-making industry here. Cuba is not a profit-making health industry. So because of that, the way they go about making decisions on the health perspective is very different from what we see in the United States.
Yes, certainly. I mean, my immediate reaction when I visited Cuba was just when we got to see the kind of neighborhood doctor system that exists. And it was just mind-boggling to imagine that you could walk up the street and visit your doctor or call them really at any time to be able to have them see you and have a relationship, a real relationship with your doctors on an ongoing basis. And the fact that that's all universal, that that's free, that that's considered a human right was what completely blew my mind, because Cuba's healthcare system, if you ask me, is one of the greatest healthcare systems in the world. Its limitation is only because of the U.S. sanctions and because of the blockade. If it wasn't for the blockade, we could see what is completely possible with a model that puts people first and not profit first. So, Dr. Steve, I'm actually really curious, just on the same note, about this idea of medical debt. In China, is it possible? Is bankruptcy due to emergency medical situation? Is that possible in China? Are people worried about going bankrupt from going to the hospital there?
I think it is the possible situation for Chinese patients, go bankrupt, like people spend a lot of money in hospital. I think that's possible. I think it's the same for different countries all over the world. For example, in China, you may expend 1 million yuan in ICU or maybe the price of targeted medicine could be very expensive. It will be a huge burden for normal patient. But when it comes to ER, emergency room, I think the medical expense is just fine. No one's gonna lose everything there, I think. Yeah.
That's an important difference.
Yeah. Like what I mentioned before, the medical service price is decided by the bureau. It's different for consulting fee or nursing fee, operation procedure fee. It's like what I said, totally decided by the bureau. So there's no exception in emergency room. I'm an orthopedic doctor working in public hospital, Beijing Hospital, one of the biggest public hospital in Shanghai. For example, someone just fall down and has his ankle sprained. When he come to Beijing Hospital, he need to make a registration at front desk. It will cost him only 25 RMB, maybe 24, it doesn't matter, I can't remember. Then he comes into my consulting room. Regularly, I will recommend an x-ray. It's about 70 RMB. If he is a lucky guy suffering no fracture, he may just leave, go back home with an invoice less than 100 RMB. It's like 13 bucks.
Yeah, that's, wow, $13 to get an x-ray. I mean, my God, I don't know, Samira, what you think about that.
I mean, that's amazing.
And when it comes to MRI, the price of MRI in Beijing Hospital is around 500 RMB, equals to $70. It's almost the same price in other public hospital in Shanghai.
Yeah, that's quite the difference. Number one, I cannot speak to what the cost of an x-ray is in the United States, but I know an MRI is $800 to $1,200. So $800 to $1,000 and $200 for an MRI. But if we talk about x-ray in Cuba, there's always, it was so interesting during my time there, at every hospital, even though there is nothing like charging people for any services, there would be these posters that are all over in the hospitals and clinics and medical offices, which say that la salud es gratis pero cuesta, which means that, you know, the health is free, but it costs. And then it would line up the cost of different services that the state, the government pays for. So, for example, the X-ray, a few years ago, the poster would say that the X-ray costs about 99.3 pesos. 99.3 pesos in the old system, economic system is about roughly $5 for an X-ray. And then for ultrasound, 148 pesos. So also divide that is maybe $7. And that's what the state is paying for that service. And it comes free to the patient. So you can see the stark difference for Cuba versus the United States and China, from what we've heard from Dr. Steve.
You know, and it's really amazing, Dr. Samira, that you share this, just because it's kind of, it blows my mind, because Cuba is a country under severe blockade, severe sanctions. I mean, it's a situation where it's stunning to me that the government would be willing to spend what precious little money they have on healthcare in this way. So I'd love for you to be able to talk about the Cuban medical system in relationship to the blockade. What were the challenges while you were practicing medicine there, and how does the blockade play such a role in the day-to-day lives of Cubans?
It's hard to even explain all the different challenges the Cuban healthcare system faces because of the blockade. Basically, the United States has decided to crush the Cuban economy by any means necessary through these sanctions that have been enforced over these decades. So everyday struggles of the healthcare system, number one, in terms of access to essential medicines, this is something that is a constant struggle. The US government will always say medicines are an exception from the blockade. They are not targeted by the blockade, but this is not true because there's a clause in the laws under the blockade that stipulates that products that have more than 10% US made parts or cannot be sold to Cuba or cannot be in Cuba, right? And so this speaks to a lot of medicines that unfortunately in the world we're living in have been patented, right, and are owned by a lot of these same pharmaceutical companies that we were talking about earlier. They have monopolized the industry to a large extent. And so for you to be able to access even raw materials that you need, for example, in the case of Cuba, in order to develop their own medicines, you still have to appeal to some of these companies and say, hey, can you please make an exception and sell to us? We need this in order to develop the medication or whatever treatment we need. And a company can flat out say no to Cuba because of this blockade and the fines that a company could incur by doing business with Cuba. So this has played out even in, for example, something as basic as aspirin, right? Aspirin, the biggest patent for aspirin is by Bayer, right? At some point in time, Bayer was saying, no, we can't sell anything to you. And that's a huge blow in a system in Cuba where there's a preventative approach to how healthcare is delivered, number one, and you have something as basic as aspirin that you need to procure for the population that needs that as a preventative measure to prevent heart attacks or to prevent any kind of heart disease, and yet you don't have access to it. So you have to now find new ways to combat that that scarcity or that lack of a resource, right? And so that's just one example. In the pandemic, there was a situation where there was a lack of parts to keep ventilators going on the island. And in their quest to buy ventilators, which had a huge amount of US parts in them, they were denied as well. This is unheard of in the midst of a pandemic, where we think solidarity, brotherly and sisterly love is going to trump any kind of difference that we have. No, our government would rather see Cuban people suffocate literally than to grant them ventilators, right? And the same happened with oxygen. So these are some of the unfortunate real life examples, and this is just a couple. There are so many examples that doctors, nurses, the scientists could tell you about what they have confronted for decades. Not just a matter of even this pandemic, the ongoing battles. And it's like Cuba's trying to find a way to stand on its own feet, but it gets kicked each and every time through these sanctions. And it's with friends like China and others who have in Venezuela who have given money and resources in order to help the Cuban situation, but that is not going to fix the situation, right? The blockade has to be lifted. The blockade has to come to an end so that people can really see the full potential of what Cuba has to offer.
Yeah, Dr. Samira, thank you so much for sharing all of that about the blockade. I mean, I really think that it's such a vital, important piece of this, because the question really is, why is there a blockade against the Cuban people? And it always comes back to the fact that the U.S. is trying to punish Cuba for being socialist, is trying to punish Cuba for attempting a different way, for attempting to actually be able to put people first and not profit. So Dr. Steve was telling us the other day just about kind of the perspectives in China around like private healthcare, this private healthcare that's beginning to emerge in different ways in China. Some private clinics exist, and there's a kind of an attitude on the internet and just among some people that private healthcare is a good solution, or it's the way that we get out of the long wait times or the kind of interactions with doctors that people are not so happy about in the public healthcare system in China.
There's an example. I have two friends. One of them is the first patient. The first patient is a female, and she's got a meniscus repair surgery in public hospital. She was not satisfied with that period, and she complained to another patient. They know each other. The second patient, she's got a problem of a psoriatic disease, and she needs to do the psoriatic surgery. She don't know where to go. She said, can I go to the private hospital? Because the first patient said the public hospital is totally a nightmare. And the second patient asked me for the advice, where should I go? I said, okay, it's totally different. The first patient, she's got a small surgery, And all she cares is the service, the language, or the environment. But your problem is totally different. It's a thoracic surgery. All you want is safety. So my suggestion is you should go to public hospital. After 2 weeks, when she came back, she said, okay, thank you, Steve. I appreciate that. The experience in public hospital is still a nightmare, but I appreciate it because I just survived. The most important thing is doctors' experience and skills.
And I'm really curious your thought, Dr. Samira, as somebody who's been in both private and public healthcare settings, that what would you say to somebody that says a private healthcare system is superior, it's better, and all the different reasons that they usually give, which is that it's faster, the quality of care is better? I'm curious your reaction to that perspective, and what would you tell those people who are arguing that private healthcare is actually the direction that China should go?
Well, let's see. I do not think that private healthcare is necessarily better, simply because I have seen what it means to take the control of health out of private sector and put it into the public sector, into the hands of the government, which is made up of everyday people who decide and also benefit from this healthcare. I think it's a matter of priorities and for us to really see, again, the importance of fully allowing, for example, in the case of Cuba, for it to manifest its system on equal footing, right? Right now, it's very complicated with the blockade and all, but even despite that, and even despite the fact that they don't spend as much money on their healthcare system, they're able to achieve incredible health indices. We're talking about a country that has a higher life expectancy right now than the United States. This is not by any mistake. It's not by the fact that they have spent more money in the private sector or any sector outside of the public sector on health. It also has to do with a lot of people don't realize not so much what they have spent in terms of building health infrastructure, in terms of hospitals and clinics, but guaranteeing social determinants of health like education, housing. Those are fundamental things, right? In addition to healthcare health being a human right, those are also human rights, right? And so when you have that, when you also guarantee safety, those are all things that contribute to a healthy individual, right? And so us being in a system where we don't invest enough in those things, right? And yet we are investing so much in hospitals, clinics, technology that is limited to only people who can pay, is missing the point. We have to start looking at how we can fund those social determinants of health in a proper way, and a lot of that has to be public rather than private. And even if it's going to be private, for whatever reason, it has to be at a community level for people to be engaged, have a say in that process. That's a lot of what happens in the Cuban end. It's not just the government deciding. There are social actors within the community level who say, yeah, we think this is okay. We don't like how this is going. We need to roll that back. And this is a continual assessment of their system. They continually review how things are going, right? They've been doing that since the triumph of the revolution. They try things out. It doesn't work. They ask the population, what do you think? How is this going? People protest, people complain and critique, and they take those critiques into consideration in order to reinvent and improve the system. We are not doing that.
No, certainly, Dr. Samira. I think that's such an important thing you've outlined for us. And one of the things I really do want to share about the United States healthcare system for folks in China who don't quite fully see the picture, it's the average person in the U.S., 30% of our wages are taxed. And all of our money, All of our tax dollars in the United States overwhelmingly goes to the military. We don't have money that's earmarked going towards public health or public health initiatives, so it's a fully private system in the United States. And what that means is that, most of us make jokes here in the US about like not calling me an ambulance. It's like such a thing, especially amongst young people, where it's like come on, like it doesn't matter if you have a broken leg, like don't call an ambulance for me because you can't afford it. I mean, an ambulance ride with insurance is like $300. Nobody has $300 to get into a car that's going to take you to a hospital that you're going to wait probably 10 hours to see a doctor at anyways. I mean, most recently when I was at the ER, actually, I saw one woman who broke her thumb and she was just bleeding and she was just sitting there. I mean, like, that's just what it is. She waited, I think 6 hours it was to see the doctor. I had waited 8 hours, so she went a little bit before me. But the concept of emergency isn't even an emergency in the US. I mean, it all depends. I mean, that's how bad the system is because most people who can't afford healthcare wait to the very, very, very last minute to see a doctor, oftentimes when things are too late and it's too difficult to really overcome in preventative care. It's at a point of crisis for somebody. And that's how the US system has been operating. Even if you have primary care doctors, a lot of people can't afford to see a primary care doctor regularly. Not to mention if you're undocumented in the US, you're not going to have access to really insurance or any of these other systems. Or if you're unemployed, all of our insurance in the US comes through employment. So if you're unemployed, you don't have health insurance. So that's kind of the big fear too amongst people, is that if I lose my job, well, that means I have no ability to have health insurance. There's no other option for them. Sometimes there's COBRA, which allows you to have some kind of minor coverage over a period of time, or there's kind of government insurance, but the government insurance is still incredibly expensive. I mean, I know people that pay $300, $400 a month for one of the plans that's offered through Obamacare. So it's really interesting to me to see that even what's offered by the government, it's not subsidized care. It's just care that's offered to I guess, make more money. So I think it's important to get a real solid sense of what it's like to be in the United States, especially during the pandemic. I mean, during the pandemic, forget it. I mean, I was waiting outside of a hospital once because they ran out of seats and beds on every level to even go inside. I mean, that's how deep the crisis really was. And so it really is something that I think is important to highlight about a private system, is that you do end up having the same experiences in terms of quality of care on so many levels, but then you pay so much more. You pay exorbitant amounts. I once met this young man at a protest, actually. This was very upsetting. He was 26. He was like roughly my age at the time, and he had cancer, and he had pretty severe cancer. And so he actually lost his job when they found out he had cancer because he had a job that was more physical. And so they obviously discriminated against him and didn't want to continue to employ him because they didn't want to pay for his inevitable medical bills. And so his whole family went bankrupt, having to sell their house to be able to pay for his treatments because he had to start paying out of pocket. And it became a compounding issue where he lost literally everything. Him and his parents lost everything in trying to cure his cancer. And he, of course, couldn't get access to the best treatments. And that's one of the things they say about private healthcare in the US is you have access to the best treatments in the world, but the best treatments are only for the rich. It's only for people who can afford those experimental treatments. Either way, I think we are going to have to leave it right there for today. Thank you so much for joining us, Dr. Samira and Dr. Steve. There is so many more questions I have, but I think we're going to have to leave it there.